So listen, or not, let's talk about UTIs. So first of all, what is a UTI? UTI stands for urinary, that's the U, tract, that's the T, infection. And so basically all this is that you have a bacterial infection in your urinary tract area. And guess what? It affects all blood types, not just A, O, B, and AB. All of y'all get affected with UTIs. And guess what? It's not just females, it's also men. So yes, females do get urinary tract infections more often than males, but it can affect males as well. So what causes a UTI? Well, pregnancy can cause a UTI, sex can cause a UTI, anything that blocks your urinary tract. So think kidney stones, constipation can cause a urinary tract infection, wiping the wrong way. So let's talk about how to prevent UTIs, right? So one is wiping correctly. So for females, you're wiping from the front to the back, your vagina to your butt, not your butt to your vagina, okay? You gotta wipe correctly. Otherwise, you're putting different bacteria in different places in your vaginal area, and your urinary tract does not like that type of bacteria. They don't play well together, okay? Another way is hygiene, right? So making sure that you're not holding your pee in and going to the bathroom when you're supposed to. So those of you guys who work these shifts and you're like, no, I don't get a bathroom break for a certain amount of time, that's not helping. It's not helping, all right? So go to the bathroom when you feel like you have to go to the bathroom. After sex, pee. Get that bacteria out of you. Pee, wipe. When you're taking a shower, this is a tip from Dr. Mia Cowan, okay, from MiBella Wellness in Birmingham, Alabama. You're going to wash with Dove white soap. That's what you clean your private parts with, Dove white soap, okay? So conventional medicine is going to give you an antibiotic. Duh, you've got bacterial infection, right? So of course they're going to give an antibiotic, and it works, okay? But what I'm here to tell you is that every single time you take that antibiotic, you're wiping out all the bacteria, even the good bacteria. So you have to take a probiotic 30 minutes to an hour afterwards so that you're replacing the good bacteria. Because guess what? If you don't, you can end up with a yeast infection or another urinary tract infection. So listen to me when I say, when you take those antibiotics, you need to take a probiotic either 30 minutes to 1 hour after you take the antibiotic, all right? So what do we do naturopathically? Cranberry juice, uva ursi, drink lots and lots of water so that you can flush it out. I like something called Bio-Vegetarian. It's our version of a natural antibiotic with a bunch of different herbs and things in there. I also like Biocetin, but if you're going to use things like that, then you probably need to consult with a naturopathic physician or someone familiar with those products. What are some of the symptoms of a urinary tract infection? So burning when you're peeing frequently. What else? Cloudy urine. In the elderly, it presents a little bit differently, like confusion, agitation, incontinence, or more incontinence than normal, and also shaking, like the rigors. In the elderly, a urinary tract infection is really serious. So make sure that if you're caregiving or you are, probably 55 or older, that you're looking for those things. And you can also present with a fever because it is a bacterial infection if you have a urinary tract infection. So you can listen. I'm just Dr. Sam Price. I'm a board certified and licensed concierge naturopathic physician for the last 20 years. So go ahead and book the call or not. So listen, you can book a call at speakwithdrsam.com or not.